And COVID cases are rising in many parts of the country, and we are not talking about Delta, Alpha, or the original Omicron. Tonight, we're talking about subvariant BA.5. This is the most transmissible COVID variant so far, and if you've had the vaccine or if you've had COVID before, there is a good chance you are not protected and could still get this. And the CDC says BA.5 is now responsible for more than half of new cases right now in the U.S. And here to help give us a better picture of what we're dealing with is Dr. Anthony Harris. He's CEO and Medical Director of HFit Health. Thank you so much for being here.
Thank you, Natasha, for having me.
You know, Dr. Harris, people are tired. They are tired of being so careful, of being isolated, of deferring their travel. But we are seeing this surge of BA.5. And even if testing is lagging, wastewater does not lie. And we are seeing numbers that are comparable in many places to the December-January surge that so many were worried about initially. So the first question for you, are we in the middle of a surge right now, and do we just not know it?
Sure. So we do know that the numbers that we're seeing now are woefully underestimated, right? Because everyone is doing home testing and tests per million is down dramatically compared to where we were this time last year. So yes, the numbers are dramatic right now, and they're going to get worse, unfortunately. If we look at BA.4 and BA.5, I mentioned them together because they have the same spike protein. We can go through history and we can look at why these two are so different. If we look at the number of people that are infected by the original, not Omicron, but the original back in Wuhan, it was 3.3 people infected by one person who had COVID. That number jumps up to 5.1 for Delta, 9.5 for BA.1, and then incredibly 13.3 and then 18.6 for BA.2, now BA.4 and BA.5. So again, dramatic increase in infections because we have a much more dramatic increase in the infectiousness of this BA.4 and 5.
Well, Dr. Harris, how do the symptoms of BA.5 look different from any other strains? We're seeing the runny nose, the sneezing, the cough, the headache, also hearing about some night sweats in some cases.
Sure. The fever is back, right? So we know that early on, fever was a part of the milieu of symptoms that people presented with, and that may be coming back, and that may represent the night sweats that people are experiencing. And certainly most are experiencing what they refer to, my patients included, as a head cold, right? And so that's the runny nose, the congestion, the sore throats are still there. And so we're seeing less of the rashes and things of that nature. But again, this is still something that's going to continue to evolve. Look, we said 5 years was the timeline for dealing with COVID, and it's still holding true. And unfortunately, it looks like the fall may be more dramatic than what we're experiencing even now.
So it does sound like, from what you're saying, infection with BA.5 can be pretty mild in many cases. People can treat it at home. But do you think people are focusing on the right thing? Because we are seeing emerging research that with each repeated COVID infection, no matter how mild it may be in the moment, it can increase long-term risk of stroke and heart attack and diabetes, kidney issues, even dementia. So what would you say to someone who says, you know what, I want to live my life. If I have to stay home for a few days with mild symptoms, that's fine with me?
You bet. You nailed it on the head, right? In terms of chronic disease as a result of COVID, that's why people need to be still cognizant, protective of prevention of contracting COVID, and frankly, why we still should be pushing vaccination. We know that vaccination will decrease the number of not just transmissions, but severity of illness, and it will also decrease your risk of having these long-term effects. And that's why we see Pfizer and Moderna coming out with bivalent vaccines that are effective against the original Omicron and Delta, as well as BA.4 and 5, so that we can continue to have a demographic of individuals that are protected against these long-term effects. And you're right, it's multiplicative in terms of continued infections. And it comes down to the underlying issue of blood vessel augmentation by the virus itself, right? It gums up our blood vessels, to say it frankly, and that's why it can affect the brain, the kidneys, the liver, and frankly, most of the end organs we are concerned about in terms of chronic disease, it hits, including diabetes. Increases your risk of diabetes type 1 because it affects the pancreas.
And, you know, we talk about vaccination. Speaking for the viewer at home, what is so frustrating for some people is that we know the booster was not specifically designed for this strain. So I've heard people say that they're just going to wait until later this year when we get a new Pfizer or a new Moderna vaccine that has some additional protection for the newer strains. Do you think that's a good strategy, or why should everyone go out who's eligible and get their second booster right now?
It all comes down to timing, Natasha, on this one, right? And so the answer emphatically is go out and get your boost if you're eligible for it now. And don't wait till the fall, because likely these vaccines will not be available for specific protection against 4 and 5, BA4 and 5, until after your current booster has waned in terms of its effectiveness. 90 days is roughly what we say in terms of the boost starting to fade out. Now, it's not ineffective at that timeline, but again, 90 days is when it starts to fade out. So you want to have as much protection as you can right now, particularly during the summer months. This is where we have the most travel, and we know that travel breeds communication with individuals and infections, right? That's part of the R0 or reproductive rate calculation. And so protect yourself now, and then when it's available, get another booster if you are eligible for it, for sure.
Dr. Harris, it's so hard to stay this vigilant for this long, but we certainly appreciate the reminder and your perspective. Thank you so much.
Absolutely, my pleasure.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.